Well, for more on the changes in California, we are speaking tonight with Dr. Rimoin. She's an epidemiologist and professor at UCLA's Fielding School of Public Health, the director of the university's Center for Global and Immigrant Health, and an expert in the fields of global health, emerging infections, and vaccination. Dr. Rimoin, thank you so much for joining us tonight.
Nice to be here.
So we know that during the early winter, really just a few weeks ago, California hospitals, medical workers, all just stretched to capacity. But now the governor's lifted those stay-at-home orders. Can you talk about the difference in COVID cases across California?
Well, you know, what we're seeing here is the tail end of the surge that we had from the holidays. And it's starting to, as the governor said, we're starting to see things moving in the right direction. And the models that we've now seen that have been released are also suggesting that numbers are going down. Now, that said, we are beginning to see new variants emerge that are more contagious and are certainly here in Los Angeles, and they will be gaining traction over the coming weeks. So we may be in this period where we have a lull, and this might be the time, if they are going to be opening things up a bit, to do it. But I think that the key here is that nobody can start to relax. People really need to take precautions very seriously, and all of the measures that people can take to stay safe, they should. That's social distancing, being vigilant, wearing a mask, and really sticking to these limits of occupancy.
Well, and doctor, kind of speaking on that, and you know, knowing what you know, as well as knowing that there are those variants out there, really, what does this rollback mean going forward as far as those potential case numbers and infections?
Well, you know, it's to be seen. You know, I think that I, as along with other epidemiologists, we always like to have a little bit of more margin of error here. We'd like to have a little bit more, maybe a little bit more time to keep seeing these numbers going down. But we're also, you know, in this situation where we're balancing public health and the economy and people's livelihoods. And so I think that this is always a balance. We don't know where it's going to go, but we need to be monitoring it carefully. What we need to be able to monitor all of this very carefully, though, is also very good genomic surveillance. And that's going to need to increase enormously so that we can get ahead of this. And if we are starting to see a surge that's related to a more contagious variant, that we are able to get in front of it. We're constantly chasing behind this virus. We need to be in front of it.
Well, for those of us outside of the medical profession, can you just talk to us about what you were seeing and experiencing right now as a medical professional, specifically in California?
Well, as an infectious disease epidemiologist, you know, I deal with numbers and I deal with trends here. I'm also leading the studies on asymptomatic infection and immunity in health workers and first responders. And, you know, what I can tell you is that over the last several weeks, we've just seen an increase in cases here that's been enormous. But as these cases go down, we're also going to see hospitalizations go down, and then the ICUs are going to clear up. We've seen this trend happen. What we're seeing in terms of these new variants that are occurring here in California, you know, we're now starting to see a trend here of more and more of this California variant that has been spreading so rapidly. This is more contagious. We can expect to see more cases. We also know that the UK variant is spreading here, and we are certain that there are others. We just haven't been watching closely enough.
And doctor, just what about the fact that people are going to travel? We know people are mobile. What about those people traveling within the state? Since, you know, some counties have looser restrictions, some hair salons will begin to, you know, have in-person business. So even if someone's in a hot zone, they can still travel outside of it and, you know, and utilize some of those services.
Well, I think the one thing that this pandemic has driven home is that an infection anywhere is an infection everywhere, and that is certainly true within a state or in a smaller geographic region. So what the situation here is, you know, that when we start to open up, the onus really comes to the individual to really do everything that they can to be able to reduce spread. That's wearing a mask and wearing a really good mask. You know, there's been a lot of data that's come out recently about having a very effective mask, having a KN95 or a mask that has 3 layers as opposed to a very thin one. If you must wear a thin mask, make sure it's very well fitting and wear a second one on top of that. 2 masks that are cloth masks are each cloth mask is about 50% effective, but if you double it up, you end up with about 75% efficacy at preventing spread of this virus. So I think that these kinds of things are going to be really important. What I say to people all the time that too is just because you can do something doesn't mean that you should do it. So, just because you can go out, just because you can go to restaurants, I think that people need to really, they can get together with other people, that you really need to think about your own risk, the risk of the people in your household, and what the results will be if somebody does get sick. It's still, COVID is not over. The fact that we are going from complete lockdown to a tiered system, we're all still in the purple tier. We're still in the most restrictive tier here in California, and most places in California, certainly in Los Angeles, and that means that we are nowhere near out of the woods.
All right, epidemiologist Dr. Rimoin, we thank you so much for your knowledge tonight. Thank you.
My pleasure.